Hi, doctor, how are you doing? Well, first of all, thank you very much once again to follow my work and to be there in the other part of the screen. I don't know from where you are watching this video, and well, trust me that I feel really connected with everybody all over the world. I receive messages from many people every day through different platforms, different channels, and well, just I want to tell you thank you very much, and let's continue doing the thing that we are doing. That is helping people to achieve and to get better results with our patients in their life. And me as a speaker and as a trainer, I love to help people to achieve a next level uh, with they work with aligners. Okay. Well, I don't know if I told you that, but about a year ago, more or less, or I moved my office to 100% aligners. Okay. I solve all my cases with aligners, with some specific exception. For example, in cases where I want to start the case in a really young patient, for example, when I want to start opening spaces for canines or something like this, where I bond some braces and I put a degainer, okay, with the Damon system philosophy only in these cases. But for the rest, we only offer and we only do it only with aligners. And well, Dr. Theo, why you move to aligners and why you didn't maintain the work with braces? Only for one reason, okay? Because for me, right now, it doesn't make sense to work with braces when we can work right now with a really high level of aligners. So it's not thinking only about the business. That of course, the business, if you manage well the system, I think it's going to be much better for you, because when you work with aligners and you work and you control the protocols, you are going to visit less time your patients. So they are going to have less appointments. So the profit for the office will be better, and you are going to have less urgencies, so the patient will come less time, okay, to solve problems like braces that fall down and the arches that are hurting. You are not going to have these urgencies. But the most important reason, the most important reason why I'm doing only aligners right now is because the results are much better right now and much accurate right now with aligners than with braces, because we have the tools that we have right now with the software are amazing. You can control now everything: the sequence of movement, the final shape of the arches, where do you want to do anchorage, which teeth you want to move in each stage, the amount of movement that you want to do in any single tooth. You want and you can increase or decrease the speed of the movement. Can you do that with braces? Of course not. All these things that right now we can manage and plan with aligners, it's not possible to do it with braces. Okay? Why many people and many doctors all over the world they are still doing braces instead of aligners? I think it's only for one reason. I think it's because, well, one of the main reasons what I call the old school. And the old school is fantastic. I make a joke that I love to train in the gym like Arnold Schwarzenegger is following the old school training program. This is what I love to do it. Sit-ups, pull-ups, high volume. This is the way. So the old school is fantastic. Okay? And the old school in orthodontic, in many things is fantastic, but we have to open our mind to the new things that came in the past and are coming, because the result of following this tendency are better result for our patients and better quality of life for us. Why many doctors are still doing braces instead of aligners? Is because probably, not all of them, but probably they think and they feel really comfortable. They feel and they are comfortable in their comfort zone. They are doing a good job with braces and they think, why do I have to change if I'm doing a good job with braces? I can give you an answer. You have to change for your patients, because your patient deserves something better. Your patient deserves a treatment where you can achieve a better result. Your patients deserve a treatment where they are going to be more comfortable, where their quality of life is going to be better. So if you remove from the equation yourself and you put the patient first, that's the first reason I think you have to move to aligners. Is the way to learn it easy? Well, it's not easy, but it's not difficult. Okay, it's not difficult right now. If you follow the different training programs, if you follow my training program that I do with Master Coip, or you download my app InView Ortho Pro, or you go to different channels, you will find really good training programs where you can learn how to do it. The companies like Ormco with Spark, like Invisalign with their product, they are giving good training. So right now it's easy to learn how to work with it, okay? And the software to work with it is so easy. It was difficult when I started about almost 20 or 18 years ago, when I started using aligner. It was hard to learn that, because we learn by testing different protocols, by testing the material that we had in that moment with a really basic programs to do it. But right now we are in a moment where the aligners are amazing. The companies are doing a good job. The predictability of the movement that we are planning is, if you know the protocols, is fantastic. So my recommendation is, because, and do you know why I'm recording this video? Because I want the best for you. I have a philosophy of life where if we help each other, the life is better for everybody. Okay? So if I do a better job in my training, I'm going to improve your life. If I improve your life, you are going to improve the life of your patients. And everything is a chain. Improving. Okay? That's why I'm recording that. About the aligners, well, as you know, right now I'm using more Spark aligners. Are my aligner as reference right now. But you can use other aligners. Okay? If you ask me for a recommendation, I would recommend you use Spark. But I have been using Invisalign for many years, and I only have good words to Invisalign. It's also a really good technique. Okay, I have nothing bad to say about Invisalign, because it's also an amazing technique. But for my personal preference, because it's something that I have been working from inside, where they are applying my protocols and where I have seen some advantages That's why I'm using Spark. But the key point here is aligners. When you know the biomechanics, when you know the protocols, you will be able to use these protocols and biomechanics in different channels, in different platforms. Okay? That's why, if I can give you an advice from Spain, from Dr. Diego, don't wait, okay? Because the time flies. We are not here forever, as you know, and the business moves too fast. Right now, the boss is the patient. The patient is calling to our office asking for aligners. Why? Because they want a better life, they want a comfortable life. They don't want and they know that everything can be achieved with aligners. Okay? So trust me, jump to the aligners world. It's going to be the best investment I can tell you in your professional career. Don't hesitate to contact me, Dr. Diego Pedro. You can follow me here in YouTube, in Instagram, wherever. I have a philosophy of life where I love to help people. So if you have doubts, contact me, send me a message, ask me for advice, and I will help you. Trust me. But you have in front of you a really amazing future. And I hope to see your success, and I hope to see you personally really soon, and that you, after a conference or after a lecture that I will be, I hope really soon, is again giving my lecture all over the world. I hope to see you, and I hope to hear from you that Dr. Diego, I follow your advice, I'm doing aligners, and I'm in love with that decision. Doctor, thank you very much, and I hope to see you really soon. All the best from Spain.